Incontinence-Associated Dermatitis, Prevalence, Economic Impact, and the Benefits of Prevention. Incontinence-Associated Dermatitis, or IAD, is an inflammation of the skin that occurs when the skin comes into contact with urine and/or fecal matter. It can be both painful and embarrassing for patients and is a well-recognized risk factor for the development of pressure ulcers, which are not only painful for patients but also expensive to treat. Although providers take steps to prevent it, incontinence-associated dermatitis continues to occur. In a study of acute care patients, the overall prevalence of incontinence was 19.7%, and of the patients suffering from incontinence, 42.7% experienced skin injury. In addition, as many as 5.6% to 50% of long-term care residents experience IAD. The economic impact of incontinence-associated dermatitis is significant. The inflation-adjusted annual estimated cost for skin conditions related to incontinence in the United States eclipses $215 million. On average, the inflation-adjusted cost to treat one mild to moderate IAD episode in one resident is $169. The presence of skin damage from IAD may increase pressure injury risk. Patients with fecal and urinary incontinence are 22 times more likely to develop pressure ulcers than patients without incontinence. If an incontinent patient is also immobile, he will have a 37.5% greater risk of developing a pressure injury than one who is neither. The average cost to manage a single full-thickness pressure injury is $70,000. Research suggests that healthcare providers and incontinence patients benefit from the implementation of an evidence-based skin care regimen. In a 2008 study, the incidence of IAD in nursing home residents during use of a defined skin care protocol, quality products, and staff education was reduced to 3.4%. In another study, cost of care for IAD was cut in half following the implementation of a new program that included product modifications and intensive staff training. In addition to cost savings, a new skincare regimen program saved a nursing home staff 34 minutes per patient per day. The implementation of an evidence-based skincare regimen, along with the proper use of high-quality incontinence products, have been shown to prevent the onset of IAD and manage overall healthcare costs. If a patient's incontinence is mismanaged and the patient suffers from IAD, there is a 5-fold risk that the patient will develop a painful and expensive pressure injury. Plus, the occurrence of IAD may reduce perceived quality of care within the facility, diminish patient and family satisfaction, create susceptibility to litigation, and lower a facility's utilization of services. Shield Healthcare offers educational materials and informative webinars designed to provide you with the latest news, trends, and best practices in skin preservation. For more information, visit us at www.shieldhealthcare.com/community.